Back now on the show, we're going to focus on the issue of mental health in these COVID times. It's been an unprecedented situation. We've gone from lockdown to worries about the economy to fear of contracting the virus, working from home. The schools have shifted online. It's all been a very stressful time, a lot of anxiety, and it's important to acknowledge that. To talk more about this, we're joined by Dr. Shwetambara Sabharwal, who's a psychologist and a psychotherapist who's in fact been giving therapy to people during this lockdown. Tell us about it, Dr. Sabharwal. What has it been like? A lot of people reaching out to you. You've also been counseling people suffering from coronavirus.
Yeah, thanks for that question. I think the experience of therapy has been challenging, to say the least. One of the things that we bank on very immensely is rapport with people, and that really needs one-on-one counseling. We also need clinical observation. We are not able to see them sometimes, and also a lot of testing procedures. So the entire experience has been very challenging, largely because of procedures. We have had to adapt very quickly so that we can provide critical support. The second thing has been that it's been worrisome because in my 16 years of experience, I have never before seen such influx and elevation in incidences and intensity and consequences of stress and distress. A lot of our patients who are already doing better or recovering have had relapses, so that has been extremely challenging as well. I must say that there has been a lot of firefighting going on for mental health professionals because we didn't initially have guidelines on how to do online counseling. There was no legal support. There were no disclaimers. But I think we jumped right in to provide that critical support because prevention and treatment was more important. And now as guidelines evolve, we're getting our bearings right. I think the other thing that I'd like to add is that there has been very heartwarming and very overwhelming support from the entire mental health community. Right. Everyone's been there, yes, and not just within the city, but also across cities, internationally, to provide emergency interventions.
Right, Doctor, I want to ask you about children, especially during this time. So much of their schooling has gone online. You must be getting a whole range of ages that are reaching out to you during this time, but especially about children. What has your experience been?
I think children, Gargi, are extremely resilient and they're very quick to learn and adapt. I think the problem is more with the parents, and I don't mean to call it a problem or judge. Sure. I think we have all the background work to do. Parents have to quickly adapt, learn with the change and get used to this so that we can provide the necessary cushion for children. And so also the education community, and I think they've already done a fabulous job. We're back in school. The academic year is not lost. So I think it's going on well. But I must say that the parent community has taken a big hit.
All right. Well, we have a viewer question, in fact, on stress during this time. Let's just listen into that question.
So my question is, whenever I go out, I'm super scared of losing my caution even for a second and putting my entire family at danger. So how do you deal with the stress and paranoia of catching the virus every single time you go out?
All right, Doctor, I think that's a fear that many people have, especially with unlock and everyone's going to offices, returning home to their children or elderly parents. It's a big tension, a constant tension on their heads.
Absolutely. I completely agree with you. I wish I knew your name, the person who asked me the question, but I'd like to say to you that if you're feeling a little bit anxious, you know what, keep it. It's very necessary for all of us to right now recognize that concern is very important for all of us to take the necessary precautions. The only thing that we need to recognize is that when that concern crosses a threshold where it starts to make us dysfunctional, where you won't be able to leave the house, that is anxiety or fear or panic, and that needs intervention. So if you are a little worried, but you are stepping out of the house, I think you're doing fine.
All right. So a little worry is a good thing in these times. It's better not to be careless. Well, thank you so much, Dr. Sabharwal, for speaking.